Ticks are parasitic animals that are found everywhere. They can be dangerous for humans because it can happen that ticks bite humans that are engaged in outdoor activities. One of the most known pathogens transmitted by ticks is the Borrelia, which causes the Lyme disease. But there are also the Tick-Borne FlaviViruses. Among these, we know Tick-Borne encephalitis virus, Powassan virus, Omsk virus, and lupin viruses. Most of the time, people don't even realize that they have been bitten by a tick. A vaccine is available for Tick-Borne encephalitis virus, but is not present for the other flaviviruses transmitted by ticks. There are no specific antivirals to help fighting these diseases.
Tick-borne flaviviruses are endemic in several parts of Asia, Eastern Europe, and their incidence is increasing dramatically in the last years also in Western Europe. The importance of surveillance of tick-borne flaviviruses is very relevant because the distribution of the virus and the risk of infection of the population is strictly dependent on the presence of infected ticks, and this changes during the seasons and in different years. So the distribution is not homogeneous, and various parts of the country can be more or less populated by infected ticks during the season. It is important to maintain a common strategy for surveillance and diagnosis. There is not a real transnational network of surveillance, which is important to understand the movement of the infected ticks or the animals that are hosting infected ticks in the woodlands, in order to have a way to predict the distribution of infected ticks in certain areas and therefore inform the population.
The TBFVnet project is a network of 6 different partners allocated in 6 countries, which are Czech Republic, Slovakia, Russia, Norway, Sweden, and Italy. The aim of the project is to develop new protocols for active surveillance, to develop novel diagnostic tools, and to test antiviral drugs for the specific treatment of the diseases. The project also aims at creating that transnational network that is becoming more and more important for a precise surveillance of flaviviruses in Europe. In 4 years from now, we aim at establish a network of different laboratories distributed all around Europe, which will follow common strategies for diagnosis and common strategies for active surveillance of tick-borne flaviviruses.